Welcome to this quick guide on managing an intercostal catheter, ICC, for nurses. Before connecting the ICC, set up the Atrium Oasis drain system. 1. Prepare the system. Fill the water seal chamber to the 2 cm line using sterile water. 2. Check suction settings. Set the suction control dial to -20 cm HTO or as prescribed. Ensure the bellows expand to the indicator mark, confirming suction is active. 3. Connect tubing. Attach the patient drainage tubing securely. Tape all connections and ensure visibility. 4. Position the drain. Keep the drain upright 80 to 100 centimetres below the patient's chest. Apply a wound dressing around the ICC insertion site. Choose from the following options based on exudate level. Ensure the dressing covers the wound and not the tube. Excessive wound ooze may indicate an issue with the drainage system or wound closure. Ensure these nursing considerations for ICC and underwater seal drain, UWSD. Keep protected chest tube clamps with the patient at all times for emergencies. Verify bedside oxygen and suction equipment are functioning. Check that the ICC drain is secure, the dressing is airtight, and all connections are taped and visible. Confirm the water seal chamber is at the correct level. Monitor the insertion site for signs of infection and ensure adequate pain relief. Be alert for issues such as kinks, blockages, or sudden cessation of bubbling. Gently lift sections of tubing to assist fluid flow without stripping the tube. Notify the medical officer if there is a new or worsening air leak. Change the dressing daily or as needed for heavy exudate. Document all findings, including air leaks, drainage totals, and any signs of infection. When the ICC is no longer required, the removal must be performed by 2 staff members. Follow these steps. 1. Preparation. Provide analgesia if needed. Explain the procedure to the patient and ensure they understand the breathing technique. 2. Patient positioning. Position the patient comfortably, usually in a semi-upright position. 3. Disconnect suction. Turn off and disconnect the suction. 4. Loosen dressings. Carefully remove the dressing and securement devices, exposing the insertion site. 5. Instruct the patient. Ask the patient to perform the Valsalva manoeuvre by taking a deep breath, holding it, and bearing down, similar to blowing against resistance. This helps prevent air from entering the pleural space during tube removal. 6. Remove the ICC. As the patient performs the Valsalva manoeuvre, swiftly and smoothly remove the chest tube with your dominant hand. Immediately cover the insertion site with sterile gauze and apply firm pressure. 7. Apply dressing. Seal the site with a sterile adhesive dressing. Consider using steri-strips for additional closure if needed. After removal, monitor the patient closely for any signs of respiratory distress, such as rapid breathing, pallor, or cyanosis. Encourage the patient to cough and take deep breaths. Document the procedure and consider obtaining a follow-up chest X-ray within 1 to 4 hours. Ensure the patient is comfortable and provide education on reporting any new chest pain or shortness of breath. Perform a final check of the system and document all findings, including air leaks, drainage amounts, and any complications. Effective management of an intercostal catheter, including safe removal, is crucial for patient safety. If you encounter any issues, escalate to the medical officer promptly. For more information, refer to the ICC policy.